Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Hi, everyone. Welcome back. Today, we'll be talking about treatment and recovery. Access to comprehensive treatment and support services is essential in addressing the opioid epidemic and supporting individuals on the path to recovery. In this episode, we'll cover evidence-based treatments such as medication-assisted therapy, MAT, offer effective interventions for managing substance use disorders, and preventing relapse. First, we explore a critical study aimed at understanding the long-term outcomes of patients treated for non-fatal overdose in Massachusetts emergency departments, conducted by Weiner and colleagues in 2020. This retrospective observational study utilized 3 statewide datasets: demographics, hospital records, and death records, to track patients discharged from emergency departments after opioid overdose treatment. The primary goal? To determine the 1-year mortality rate following treatment. So, what did the authors find? Between July 1st, 2011 and September 30th, 2015, over 17,000 patients sought emergency care for opioid overdose. Shockingly, of the 11,557 discharged patients, 5.5% died within 1 year, highlighting the severe consequences of opioid misuse even after initial survival. What's more concerning is the demographic profile of those lost. With a median age of just 39 years old, the majority were men, and a significant portion were homeless. This paints a picture of vulnerability and systemic challenges in tackling opioid addiction, which we've talked about more in detail in previous episodes. A staggering 67.4% of those deaths were linked to opioid overdose, underlining the lethal nature of these substances. Most deaths were classified as accidental, occurring primarily in hospitals or residences, pointing to the need for immediate medical intervention and community-based support. The study also sheds light on timing. 20.5% of deaths occurred within the first month post-discharge, with a chilling 22.4% of those fatalities happening within the first 2 days. These statistics emphasize the critical window for intervention after initial treatment. To combat these devastating outcomes, the study advocates for early, aggressive interventions, such as medication-assisted treatments and naloxone distribution right from the emergency room. This proactive approach could potentially save lives and curb the alarming mortality rates observed in this study. If you're interested in learning more about naloxone, we talk about it in a previous episode as well. Overall, this research underscores the need for comprehensive strategies addressing opioid overdose survivors, starting from the emergency room and extending into community-based support systems. These efforts are crucial in mitigating the tragic toll of opioid addiction on individuals and communities alike. By now, we know that the opioid epidemic continues to cast a long shadow over public health in the United States, with overdose death representing a grim forefront. A second study, conducted by Skolnick in 2022, further examines this. Recent estimates highlight the severity, with opioids claiming a staggering number of lives annually, exacerbated by the COVID-19 pandemic. In the 12 months ending in December 2020, it's estimated there were 93,400 drug overdose deaths in the United States, and over 69,000 can be attributed to opioid overdose. Despite the focus on mortality rates, the impact of non-fatal opioid overdoses remains profound, exacting a heavy toll on individuals and society alike. For every fatal opioid overdose, there are between 6.4 and 8.4 non-fatal incidents, underscoring a hidden burden that often goes unnoticed. In recent years, the misuse of synthetic opioids like fentanyl has surged, leading to a devastating third wave of the epidemic. These synthetics, such as benzimidazoles, pose unique challenges due to their potent effects and widespread availability, contributing significantly to both morbidity and mortality. This context sets the stage for understanding a critical focus of a study looking at Massachusetts emergency departments examining one-year mortality rates among patients discharged after non-fatal opioid overdoses. This retrospective study, utilizing statewide data, aims to illuminate the long-term outcomes and inform strategies for intervention and support. Lastly, we end today's episode discussing Britch and Walsh's 2022 narrative review article. The article comprehensively reviews existing strategies for managing opioid overdoses, with a primary focus on the critical role of naloxone, an opioid antagonist that swiftly reverses the effects of overdose by displacing opioids from brain receptors. This underscores its pivotal role in emergency settings, as highlighted in our earlier discussions on the Massachusetts study, revealing high mortality rates post-discharge from emergency departments, and in previous episodes. Britch and Walsh also address challenges such as the rapid administration of naloxone and its acceptability outside medical settings. As we've discussed before, naloxone can be accessible to community members outside of hospitals and doctors' offices, and having it on hand could save a life. Moving forward, the article explores exciting advancements in overdose treatment, including new formulations of naloxone like nasal sprays and auto-injectors, designed for easier administration in emergency situations. These innovations are crucial in improving response times and potentially saving more lives, aligning our exploration of the broader impact of synthetic opioids and the ongoing third wave of the epidemic. Furthermore, Britch and Walsh emphasize the integration of overdose prevention strategies into comprehensive addiction treatment programs and public health initiatives. This aligns with the urgency highlighted in our discussion of the staggering overdose deaths, particularly in light of the recent estimates revealing over 93,400 drug overdose deaths in the U.S., with opioids contributing significantly. Looking ahead, the article points to future directions in overdose treatment research, including the development of longer-acting naloxone formulations and advancements in telehealth for remote overdose management. These innovations underscore the ongoing commitment to mitigating the biopsychosocial impact of opioid misuse, shaping a more effective response to the crisis. Stay tuned as we continue to explore critical insights and advancements shaping public health responses to opioid overdose, aiming to foster healthier communities and improved outcomes for individuals impacted by this pervasive crisis. Thank you for listening to the ACEDIT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and a heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of ACEDIT.